Aloha and good morning, or good day. Thank you for coming. I say aloha because this whole series really began in Hawaii. It was really a really precious, amazing experience. So this is Fountain of Life fitness training for bone density building, preventing loss of muscle, which is called sarcopenia, working on balance and being more athletic and just in everyday life. So we always like to start out with some preparation work, a bit of soft tissue work that's consistent with the needs of everybody. So first we'll take a massage ball and just roll out the pectoral muscle. So it's like there underneath the chest bone, the clavicle here at your armpit where the pec muscles attach up into your arm. When those are tight, which they do get tight from our arms being forward, pushes your head forward and also often strains the rotator cuff. So make sure you get that little corner where your sternum, the chest bone attaches and the collarbone meets, and in between the collarbone and the first rib. And I like to work the way out the edge of the clavicle, and when you get towards your underarm, then just if you lift your arm up a bit, you go across fiber of the tendons of the pecs. Then we'll turn onto the other arm. Always have the head turned away from the ball and slightly angled down so it's very comfortable. Okay, and then also consistent with all of our needs, the feet. I mean, this is very common, just rolling out your plantar fascia. Also, make sure to roll in your forefoot, around the outer edge of your foot, around the heel. Our feet atrophy, that means they lose muscle tone more quickly. The number I've heard is 35% more quickly than the rest of the body. Your other foot. So for that reason, it's critical to do specific foot strengthening training. Often, when people walk, we need to walk. We definitely need to walk and do other gardening and other activities, but then the feet break down. So we'll always include some foot strengthening work as well. All right, that felt really good. So we're going to now move to the floor. And here we're going to work on a number of different exercises for the neck and the spine and basic alignment. The items that we'll use are a broomstick. This will be consistent with our training all the time for now. And also a strap for hamstrings to do a hamstring stretch. And the ball that we were just using. And if you have a big stability ball, for our spine strengthening work, we'll be using that one as well. If you don't have a stability ball, if you have an Ottoman, I have a stool when we do our back strengthening. Okay, so we're going to start out with the massage ball in the upper trapezius muscle. So here I'm going to, so you can see it just on the right side. That's right at the base of the neck, just at the crease of where your neck attaches to your shoulder. And if you can work into that crease, the tendons that attach your upper traps in toward the cervical spine, it'll help take the tension out of your shoulder and neck. Then take the ball a bit toward the outside, more that's the belly of the muscle, the supraspinatus muscle is there. little further out toward the edge of the shoulder and slightly down on the edge of the shoulder blade. If you feel the edge of the shoulder blade, you'll notice you snap over the tendon of your upper traps. Okay, now you can continue working in your upper back or your whole body, but today we'll just go over to the left side. I do have a video about doing a full body soft tissue series with foam roller and massage ball. Many of my clients, whenever I see them, they always say, I still do that series. It really helps every day. Okay, so we're on the left side, just at the base of the neck, then toward the shoulder and the thicker part of your upper traps that might be a bit thick or hard. Here with the weather changing, the collars of the coats force the heads forward, and so people's necks are quite challenged. Okay, a little further to the outside at the top edge of the shoulder blade, and see if you can work into some of those parts that are a little sore. Okay, and then next I'd like to just release the glutes, the gluteus medius, really the ball on the right hand. If you lift the right hip up a little, put the ball slightly under, straighten the right leg, turn up vertically on top of the ball with that hip, and the ball will sink right into the socket, your acetabulum, and you'll feel the edge of your femur, your thigh bone, particularly on the outside. I think commonly because of driving, the right hip here feels sore and jammed up. And for sure, people who are right-handed, the right side dominant group, it's often more intense. And then just around the edge of the bone as you like to. If you do this regularly, it will always feel not too bad. If you go for a long hike, it'll be a little more sore, stiff. Now switch to the left side, lift the hip up, the ball not really far under, just more on the outer edge, and then left leg straighten, turn the hips up on top of the ball. And if you're new to this, it can feel really uncomfortable at first. And even if you do it daily, depending on your activities, it might be a little more or less sore. However, doing this regularly will keep your hips healthier, regenerate your bursa, allow you to walk with a longer stride, run with a longer stride. Okay, and more on the outside of the hip too. The right-handed golfers often get really sore here from stabilizing with the left leg at the end of the swing. Okay, and then we'll take the ball and here just in the back of the head. So it's not in your neck right now, just back of head. So what we're trying to do is lengthen the back of your neck. So chin toward the throat, and if you just relax for a moment, this will help lengthen your spine all the way from your skull right to the tailbone. Let the shoulders relax to the floor. And then we'll just nod up and down with your head a little. The up component, for most people, you barely need to do that. It's more when the chin comes down, we need to lengthen the neck. So many of us, the back of the neck is hyperextended and chins forward from our computer work. And again, you can leave it, but likely you'll have degenerative discs and a lot of discomfort. If you work at it, you'll be fine. Take one deep breath, relaxing the shoulders. I like to breathe into the lower back. Nod again. Keep the chin down when you do your deep breath. Okay, holding the chin down, only the eyes look up and down. And that action will also help clear in the suboccipital muscles in the back of your neck. And a deep breath. Again, the eye action. And your deep breath. Okay, so we'll put the ball away. That's all we'll do for today with that. Up next, the strap. So rather than just thinking of stretching a muscle, I like to work into the joint. So you'll take the strap under the right foot, and then take both ends of the strap into the left hand and wrap it around the back of the calf into the right hand. The knee, regardless of who you are, knee over hip. Okay, you don't need to pull your knee closer to your chest. If your knee's a little bent, that's okay, and foot is flexed here. And if you gently tug on the strap, it'll help you with your internal and external rotation of the femur. And unwind the strap, and we'll just pull and hold. So you don't ever really want to overstretch the back of your knee. If you only feel it behind your knee, I would bend your knee and then just work on trying to release more your hamstrings and calves. Ideally, you'd feel this more up into your hip joint. Left foot. So right leg is now relaxed on the floor. Right hand, take both ends, wrap it around the back of the calf. The left hand has the strap. Before you start, make sure the toes and knee are pointing straight back. And then as you rotate the leg, make sure you're not twisting the knee or the ankle joints, that your leg is really stiff. Okay, and unwind the strap. And just pull. Keeping the knee directly over the hip and toes pointing straight back toward the shoulder. Okay, and strap down. The broomstick, so this is to align your pelvis. Bring the right leg, knee over hip, so the stick's in the hamstrings of the right leg. And then you pull the left leg up into it, so you've got it in the quads of the left. And then just press the legs. Always the head angle, chin toward the throat, lengthening the back of your neck. Switch leg position. And always lower back as just a slight arch. So that's neutral spine angle. And we're lengthening the cervical spine. Okay, and broomstick down. And then from here, just take the arms out into like a Y position, palms face up. Again, we want to get better blood flow and release the nerves. The nerves from your brain and the blood vessels that run down from the chest, down the arms. So you're clearing, creating better flow. Okay, arms and legs up. Imagine you're holding onto a stability ball, a big stability ball, and really envision that in place. And as you rock side to side, you're holding onto that ball that's helping you to use your abs. And as you think of the lower back area, as you're transitioning, your lower back should always be neutral angle. You'll note maybe if you're new to this again, usually people really start arching the back because there's not sufficient core strength. But over time, over practice, you'll be surprised how quickly you can get stronger. Okay, and relax for a moment. So this is my favorite dead bug position, arms up to the sky. And if you bend the elbows at 90 degrees, keep the chin down, shoulders relaxed. Knees over hips, so we've got a 90 degree at the knee. Now, if you're really weak, people like pull the knees closer to your chest, and then you see you're shut down your abs. So the knees should be directly over the hips. Okay, now let's do this one. If you push the legs further away, yes, abs, but notice how you start using your legs, and probably you'll feel that in the lower back. So let's bring the knees back directly over the hips. So it's more abs, not legs, not lower back. And then right leg push forward only a few inches and hold. Always maintaining that neutral spine, right leg back and left leg. And leg back. And just rest. Now to even out the spine, this is kind of just an easy way for your spine rotation. You turn onto the right side, take the left leg forward. The left hand reaches behind you, reaching in the direction of the right foot. Left hand on the right knee at the front. Just keep the chin toward the shoulder, the right shoulder. Most importantly though, left shoulder is back, left knee is forward, and they're both the same heights from the floor. And keep the length of the spine, that's perfect. Okay, and unwind yourself. Left leg straight, then turn on to the left side, right leg around. Right hand reach in the direction of the left foot, and commonly here people's hamstrings will cramp up. So right hand, just reach back there. If it cramps, just keep the arm back if you can do that. Left hand, hold on to right knee. Right shoulder back. Right knee forward. Chin to the left shoulder. And same height from the floor, your right knee and right shoulder. Lengthen the spine. And as you pull your heel toward your butt, you'll feel more of a stretch in the left quads. And everybody's different. You know, there's no right or wrong here. It just depends on you. Then we'll start again. Let's do the neck strengthening. So hands can be either on your abdomen or under the lower back. Right leg back. Okay, I'd just like to mention this, that, so as I said earlier, a lot of people, like the neck is like this. It's hyperextended. And even if you try to get your chin down, you like really can't do that. So if you're one of those people, you can put like something like this. I have a towel or a little pillow or something, a book even, so you can keep the chin like this angled. Those people, you'll really feel like in the back of your neck. If your neck isn't stuck in extension, then you won't feel it in the back of your neck at all. Okay. All right. So again, hands abdomen or under lower back. Right leg is bent. Everybody, your chin is toward the throat, so you're lengthening the back of your neck. Keep the chin toward the throat. If you can do it, you lift the elbows. If you can do it, you lift the head, but keep the chin angled toward the throat. The chin shouldn't go up or away from you. Keep lengthening the spine, and then release that. Again, lengthen, chin down. If you can do it, you lift the elbows a bit. If you can do it, you lift the head. But never letting the chin get away from your chest, from your throat. Get it down. We'll switch sides. Right leg straight, left leg bent. And you may not be able to lift the head if your neck is too weak. That's okay. Just do what you can correctly, though. Okay, lengthen first, chin down. Okay, and then elbows. If you can do it, you lift the head and hold. And I like to take a deep breath here. Deep breath. Then relax. Again, lengthen, elbows, head, and breathe. And rest. Get back to hamstrings. We're going to go through that cycle one more time. A little more quickly, though. Right foot. This time just stretching. Toes and knee pointing back toward the shoulder direction. We're not overstretching the back of the knee. Knees directly over the hip. Left leg. So the head angle again, it's always the same. Chin toward the throat, neck lengthened. Lower back, neutral spine. Right leg, relaxed. And as you check these things, while we're training, it'll just become a natural habit. So overall, your health will improve, unquestionably. Okay, strap down and broomstick. Okay, now for the shoulders, the arms should be straight here, equidistant from your legs. Shoulders relaxed on the floor. Chin angle, lower back, neutral. Reverse your legs. For sure, you should feel your abs here when you do this well. This will even out the pelvis and the shoulder girdle. Okay, and down. And when we do the Y position this time, you'll notice how that's more freed up, so we've already helped improve your blood flow. Okay, and imagining the stability ball again, we're going to hug that ball and rock over to the left and hold. Then rock to the right and hold. Okay. And center and relax. And so dead bug position, arms and legs up. Right leg push forward a few inches. Really, feel it in your abs, but you still have your neutral spine. Right leg back, left leg forward. Back shouldn't arch out. And also you shouldn't feel it in your quadriceps or thighs, leg back. Right leg. And left. Okay, and down. Lying on the right side. Left hand reached toward the right foot at the back. Right hand on the left knee at the front. And most commonly, if you cramp the first time, most people the second time it's better because you've already aligned yourself. Okay, and turn onto the left side. If your hamstring's cramping, don't worry, we'll be doing more glute work, and once your glutes are activated more, the hamstrings won't grab so much. Okay, release. From here, we're just going to roll out our quads. So I'd like to turn on the left side, come up on the elbow. We're going to practice this a lot. Both knees on top of each other. Lift the hips just a few inches, then bring the right knee around. That's a really good strategy for core strengthening and for pelvic floor balancing. And for fall prevention. Okay, so rolling out the quads. If you want to, you can just sit in a chair and use your foam roller or rolling pin, roll out your quads, or build up your core strength. I would suggest one leg at a time so that you don't hyperextend your back. And always keep the eyes looking down toward the floor, not forward. If you look forward, then your back will, or your neck will hyperextend. Make sure you're on the elbows. You have your really good core strength here. All the way up, right up into the front of the hip and your hip flexors. Then the outside, the top of the leg and the TFL. For those of you who have like really tight IT band, this is the best way to help release your IT band is here on your TFL. Okay, and left leg. So starting at the knee. And incrementally work your way up. I like to rotate the leg in different angles so you're more on the outside of the quads, the middle, more on the inside. Okay, the front of the hip and the TFL on the outside of the hip. All right. So now that we've toned down the quads a little, we're going to work on glute activation and multifidi, strengthening your spine. Today, if you have a stability ball or ottoman that you can be on, that would be great. If you don't, I would just do this bird dog. So the bird dog is like this. The opposite arm and leg lifts simultaneously and you hold. And then it's down simultaneous. And you'll just alternate one side and then other side. We'll do the holding together. Always the goal is your lower back should extend. If you have a ball or ottoman, so I'm using the stool, just be careful as you're using this up and down. You don't want to lie down on your rib cage. So it's on, the pelvis should be supported. And the hinging action, today we're going to be, the hands are on the floor, so it's like a push-up position with your arms, you could say. The toes start on the floor. Today the movement is both legs lift, hold the legs up, and then we'll do one arm lift, hold, and then arm down, legs down. Then we'll do the other side, both legs lift, hold, that other arm lift, hold, arm down, legs down. Bird dog group, everybody ready? If you're doing bird dog, it's right arm, left leg to start out. Okay, the other group, everybody ready? So the bird dog group, lift arm and leg at the same time. Other group, it's separated. All right, so now we're starting officially. Shoulders are down, press into the floor. Okay, both legs lift, right arm lift, hold. Arm down, feet down. Legs lift, hold. Left arm, hold. Arm down, legs down. And again, the bird dog group, you're just alternating the diagonals. Right arm, left leg, then next left arm, right leg. Okay, both legs lift. Right arm. Arm down, legs down. Legs, left arm. Arm down, legs down. Everybody brace your lower back, whatever that means to you. Brace your lower back, shoulders down from the ears, look down into the floor. Perfect. Then both legs lift, excellent, hold, right arm. Arm down, legs down. Brace your lower back, legs up, left arm. Arm down, legs down. One more rep. Brace, use your glutes, legs, right arm, arm down, legs down. Brace lower back, glutes, legs up, left arm, arm down, legs down. And to come off, be careful that, again, you don't lie down on your rib cage. Okay, so for here, I think we'll just stand up. And next we're going to do deadlifts. Always the deadlifts is a full body strengthening maneuver. It's really the most important powerlifting or just lifting exercise to do because it does use whole body and it's an easy way for you to build up your bone density and prevent sarcopenia. So you'll need a weight. This is when you would use a heavier weight. I like kettlebells for this one, especially. Dumbbells are not very good to hold on to for deadlifts. However, if you have a dumbbell, the grip, if it's a light one like this, right, you hold on to the ends. And we'll be doing sets of 20. Today we're going to just do a neutral stance. A deadlift is a hip hinging action. The feet are just a little wider than hips. But the weight will be both hands holding on, always traveling vertically like this between the legs. If you would just practice with me for a second, have your hands on your legs. You brace your abs and push the hips back and keep the hips pushing back. Eventually your knees will bend and your hands will come above your knees, okay? And then slide your legs, hinge, the hips come forward, slide the hands along your legs. So that's the action of the hips. Just be careful of driving the knees forward because that hurts your back and knees. Okay, so here we go. We're doing 3 sets of 20. Feet are slightly angled out. Both hands hold on to the weight. Our focus here is going to be the hip hinging action. Brace your abs, tuck the chin, push the hips back. Keep the weight in between the feet, vertically in between the feet, all the time. Okay, and we'll put the weight down. And for recovery, just walking forward and backwards. Okay, today's same stance. The second set, though, focus will be the feet. The feet should be the heels, outside of feet, and all the toes. You feel contact in all those areas, and the arch is lifted. So always the big toe is pressing down, arch up, and don't let that big toe come off the floor. Okay, step 2. Feet a little out to the sides, toes just slightly angled out. Both hands hold on, chin is tucked in. Brace your abs so you have your neutral spine angle. Hip hinge, press the feet through the floor, feeling that contact. Heels, outside the feet, all the toes. You feel the arch lifting. As you press into the floor, your arch is engaged. Stand all the way up every time. Okay, and then rest. Okay, so next for the abs, that will be our focus this time. You do need to breathe, obviously. So the exhaling, or how do you breathe? When you're at the bottom, you start exhaling and squeezing your abs, so that when you come to the top, you've exhaled fully, and you'll just naturally inhale. You don't need to worry about it. You will naturally do that. Okay, this is the last set here. Set the feet. Set your head, double chin angle, I call this. Lengthening the spine, brace your abs, hip hinge. Here, exhale, lower abdomen contract, right to the top. Your inhalation will automatically occur. And then rest. Okay, and then we'll put that weight down. Okay, that was excellent. Okay, for today, our main upper body strengthening exercise today is a single arm, one arm lat pull. In the gyms, there's a bar people often use and they do like this. They sit down and pull with the bar. Now, why is that a good one? It strengthens the latissimus dorsi muscle, it's big pulling muscle in your back. It's great for your posture if you do it correctly. It's biceps and back mostly. However, what I see, and this is common for everybody, this is such a serious topic for all of us, this neck angle. So often, for example, when people do that exercise, they're pulling and the head is like that. So you lose your abs completely, and your neck totally hyperextends. It's exactly what we do all day when we're sitting at the computers. You know, you're sitting up, you're gonna have really good posture, but you get tired, and then in no matter of time we're here, right? And then we go, oh no, I better go for a walk. And then we're like this. So there's no abs, your neck is all compressed, and then we generated this later on in life and like all kind of things. So we don't want to do that. So what shall we do instead? If you have a stretchy band, okay, it should be a long stretchy band, kind of medium tension according to you. Medium tension according to you, okay? Some people have handle bands. Mine doesn't have a handle. It's kind of like, it's just a piece of tubing actually. It's okay like this. And what I do for this is I fold it like that in half, make a loop. And then the grip, this is really important. The grip is like this. It's underhand grip. Can you see like this? So when you're pulling, this will be your grip. So it's the row. If you do this horizontally, you know, you would pull like this. And this would be like a row like this. So you get back and bicep idea. Better though, for a bigger range of motion like the lats, as I said, if you have something vertical. So I have a chin-up bar. You could get a J-hook. Even better if it's higher. So something higher like that so that you can pull from here and down. That would be kind of ideal. We're going to do 3 sets of 15. So for the first set, we're just standing up vertically. I would generally do 3 sets of 25, but we'll just do 3 sets of 15 for today. You should have tension when the arm is straight and the palm of your hand again is facing up, okay? The other hand, you just have out to the side, palm face forward to stabilize your shoulder blade. And when you pull, okay, this is what I love. What I said about the neck. Keep the chin tucked in, lengthen from the top of your head so that you're strengthening the neck along with the rest of the factors here. Okay, then rest. Okay, now with regards to rotator cuff. So this is commonly, you know, people rotator cuff, they feel it back here at the back of the shoulder or the front here at the biceps tendon or up here in your upper traps. So we don't want to do any of those. So as you're pulling, the pulling action is like, think like shoulder blade comes toward the spine, and as you pull, you want to open the chest. A common error, even people open a door, they go like that. So that really strains your upper traps and puts a lot of undue stress around your shoulder joint. So the action is as you pull here, the elbow stops by the side, not like that. And again, that helps the head angle and all those variables. Okay, so other arm. And again, if you do this properly, you'll get your really good core support, you know, belly fat and all that, but you have to do it right. Okay, other hand is my right hand, palm up, other arms out to the side. Your glutes are automatically engaged. Keep the chest open as you're pulling. Feel like you're pulling the shoulder blade back toward the spine. And no twisting, okay? You shouldn't be twisting your waist here. You're very stiff. You're like your body, your torso is a platform. And you're pulling with the shoulder blade. And biceps naturally will respond. Okay, so that was really great. If that's too easy for you and you want to make it more challenging, you can change the angle. So I'm doing this also to try to get a more vertical angle. So here we are again. I have the same setup, but I'm going to try a kneeling position. Okay, so I'm doing left hand split stance and left knee down. So if you do the one leg down, it's the same arm that's pulling. The arm that's pulling, that knee is down. The front leg is knee over ankle. So I'm setting the arm, and that the hips should always be square. So now I have a more vertical angle. the back leg, so you will get a bit of a stretch in your hip flexors, and you should feel the glutes of the back leg. Okay, switch, not the quads of the front leg. Switch sides. Okay, so right arm. So you can either stand or kneel, right? You can do the same thing we just did. Okay, so your glutes are engaged of the back leg. You have a bit of a stretch in the hip flexor, trying not to hyperextend your back as you row. So that's another option to help the get better vertical angle. Then if we go back to standing, same idea, to challenge yourself and get more control, get more glute recruitment. Then we go back to the other hand, so left hand, right leg is forward. So you're again in the lunge position here. You should feel both glutes engaged, the hips stay square forward, but pay attention to the pulling. You're opening the chest, keep the chin tucked in, lengthening the spine. Do be controlled on the eccentric phase as you straighten the arm. You don't let it just pull you, don't let it be jarring, that you do have control. So you always have tension. Now we'll switch. I have right hand and right leg back. Set your good lunge position, front leg, knee over ankle, back leg, the knee is bent, heel up. The back foot, toes pointing forward, hips are square. Make sure the head stays in place. Okay, and release. All right. Okay, so next, another really important component of our training is we need to do single leg stance, not just for balance, but it helps your whole body maintain better alignment so you don't twist your joints. Might not be that you fall down, but maybe you'll twist your back or your knee or your shoulder. Today, most common, what I do every day is a single leg hip hinge. It's similar to what we did earlier, but only on one leg. For simplicity, we're going to do just 3 sets of 7. I like to have something that's grippy to stand on, so this is just a towel that has a wet face cloth on top. So that allows my foot to grip better, okay? This time you have a heavy weight, that would be the best if it's something heavy. If you have trouble balancing, you can hold on to a chair, or you can just hold the position instead of doing multiple repetitions. So we're starting with left foot supporting, right hand has the weight, right foot is off the floor. So you can just hold here, or you can hold at the low position or hinging action. We're just going to do 7. And then rest. Where you should mostly feel this is in your glutes and your buttock muscles. If you feel it in your thighs, you're just confident with your quads, you're not strong enough with the glutes. So if you could think of, use your butt more and not so much the quads. Left hand has the weight, right foot is supporting. Left foot up. So it's here mostly right glutes. Try to focus on making sure right glutes engage. Okay, rest. All right, good. So that's the hip hinge. Second set, we're doing 3 sets. This time, if you could pay attention to the pelvis. One reason people lose balance is when they do the hinge action, they pivot like that. The hip should stay level across the back. Okay, you're not twisting yourself. You know that if you twist a little, what will twist is your knee. You know, that's why people often like blow out their meniscus or the ACL. You take a step, you turn, you're pushing off like that, you go like that way, and the knee just gives out. It's not strong enough. For that reason, this will really help you just to prevent knee injuries. Left foot supporting, right hand has the weight. Here we want to make sure the hips stay level at the back all the time. Right foot up, tuck the chin, good. And rest. Okay, and walking around a little. Okay, right leg supporting. Left hand has the weight. Left leg up. Keep the hips level. Be careful of lifting the left hip up too high. The hips should always be facing floor down. And rest. And walk. Okay, so another aspect of balance, of course, vision. The vestibular system regarding balance is have your eyes and head moving independently for proprioception, so you sense where your body is. So this set we're going to keep the chin tucked always, okay? You don't let your head bob around, but keep the eyes focused on one spot all the time. Left foot is supporting, right hand has the weight. So set the chin slightly down and look with your eyes, find a spot that's kind of 2 feet away from your feet, just a little bit forward of your feet. Right foot up. When you do the hinging action, keep your eyes on that spot. And rest. Okay, last set. Right foot supporting. Left hand has the weight. Tuck the chin, brace your abs, set your eyes. Okay, and rest. And that weight you put away. All right, good for you. No, that's a tough one. Things people really don't like is the single leg exercises and also side bridge. We're going to do just one core exercise. This is a version of a push-up. A lot of people don't really like push-ups. However, there are benefits to the core component, but this is a little different. So the angle, well, here what we want to work on is evening out the diagonal vectors across the shoulder blades. Okay, this is the thoracic spine, is this part here. of the spinal column, and often it gets a bit shifted off. One shoulder blade is a little higher than the other, or one sticks out more than the other. So we want to help even out the position of our shoulder blades. So the hand angle goes like this. This hand, fingers go up. The other hand is a little lower, and fingers are to the side. Okay? And we're just going to hold there for 30 seconds and then recover. And then the other angle, this one fingers up and that one fingers to the side. So the result is that you have a diagonal vector like that, a diagonal vector like that. So when they cross together and you strengthen this, it will help even the kinematics of the scapula, the shoulder blades. So here we'll be on the floor. If you can't lift the knees up, that's okay. You can do this. I would, try, but you don't want to, again, always hyperextend the lower back. Okay, so the hand angle, if you can see, so this hand fingers are pointing up, this hand fingers are pointing out to the side. I know it's awkward, but you'll see about the core component. So you can set up just like this, right? Your knees are on the floor. And you'll note that as you're holding, that you'll really strengthen the shoulders in different angles and the abs. Just recover. Then let's do the other side. The other hand, fingers up. The other hand, fingers to the side. Brace your abs, and then you just press your hands into the floor and hold. Keep the chin tucked. Okay, we know we don't want to hyperextend the lower back, so you have to make sure that you are really engaging your abs so your back doesn't arch. Now let's try again. Go right hand fingers up, left hand fingers to the side. So set up so that you're on the knees, and then shoulders down from the ears, press the hands to the floor, just lift the knees up. And as you hold here, just the important thing is your abs, right? It's so much more beneficial. And whenever I see people do push-ups, you always see like one elbow's a bit skewed, one shoulder blade's a bit up, the other one's a bit down, the head goes forward, bring the knees down. And so my preference is these angles because this evens out our imbalances. Left hand, fingers up, right hand, fingers to the side. So you start out on the knees, shoulders down, set your arms, press your hands to the floor, set your head angle, then lift both knees. Okay, and if you're pretty well balanced, then both sides would have felt quite similar. My expectation, some people, like if you have some degree of scoliosis, you'll for sure feel it quite differently on the two sides. And knees down. And the thing is, the core part of it, like you get way more abs and way more muscles, like you can feel the rib cage, the thorax, all the intercostal muscles around your ribs. Okay, right hand up, left hand to the side. We're going to do one more each side. Start out on the knees, press into the floor, look straight down, and then knees lift. Keep pressing the hands to the floor, tuck the chin. And breathe. Breathe deeply. Knees down. Reverse, last time. Left hand fingers up. Right hand fingers to the side. Tuck the chin. Okay, set the hips down a little, tuck the chin, push it to the floor, glutes, abs, lift, hold. And knees down and recover. Okay, and to stand up as you like. And yeah, thank you so much for coming. It's a thrill to have this opportunity. Getting younger all the time, becoming more competent all the time. Have a great day. Hope to see you next week.